Welcome, everyone, to today's Explainer. Today we're diving into a challenge that is just incredibly relatable, something pretty much universal. Aging gracefully is something we all aspire to, right? But navigating the physical transformations that come with our golden years, well, it can be tough, especially when sudden, severe back pain just crashes into the picture. It's a totally jarring experience. It can literally disrupt your day-to-day life. But here's the good news. Understanding what's actually happening under the surface, that is your absolute greatest tool for reclaiming your comfort. So let's get into it.
Okay, let's dive into this. We've got a fantastic step-by-step roadmap for today's explainer. First, we'll look at the reality of aging, followed by the anatomy of an aging spine. Then we'll cover causes and symptoms, how doctors diagnose the root cause, the treatment ladder, and finally, we'll wrap up with the Reactivate solution.
Section 1, the reality of aging, the universal tale. Navigating these physical shifts in our later years is completely normal, but sudden pain? That's a critical wake-up call we need to listen to. To really put the massive scale of this issue into perspective for a second, an estimated 20.9% of adults in the United States report experiencing chronic pain. Wow, that means nearly 1 in 5 people are dealing with this. You are absolutely not alone here. Because back pain is such a common complaint as we get older, whether it's just a standalone ache or a signal of a deeper health concern, it's absolutely crucial that we pay close attention when our body decides to sound the alarm. Moving on to Section 2, Anatomy of an Aging Spine. Under the hood, let's take a little body tour to figure out exactly why these aches start popping up more frequently. To truly understand the why behind the pain, we have to look at the structural changes happening deep inside. According to fascinating research from the Hebrew Senior Life Institute, over 30% of adults aged 40 to 59 are already showing signs of moderate to severe disc degeneration. That's right, 30%. You see, the discs in our spine naturally lose moisture and flexibility over time, which causes that feeling of stiffness. But it gets more intense. As we age, there's a massive loss of bone density. Actually, by the time someone reaches 80, they can lose up to 70% of their bone density in the lumbar spine. That kind of weakening makes even the simplest everyday tasks, like just bending over to tie your shoes, a really significant challenge. Now, what's really interesting about this slide is how it demystifies a crucial yet completely overlooked factor called sarcopenia. Essentially, this is the natural age-related process where our muscles diminish in both size and strength. We so often think of back pain as just a bone or a joint issue, right? But this muscle loss severely affects our core. And think about it, without a strong muscular core, your spine literally loses its primary support system. And research perfectly captures this reality. It shows that adults over 60 experiencing lower back pain had significantly weaker lumbar muscles compared to their pain-free peers. It's a direct, undeniable chain reaction. Muscle weakness leads to muscle spasms, which then leads to severe back pain. This absolutely hits the nail on the head regarding why targeted exercise to maintain that muscle support is just absolutely essential for your spinal health. Section 3, Causes and Symptoms, Interpreting the Signals. So what exactly happens when all this structural aging suddenly shifts into unexpected severe pain? Well, let's look at the primary culprits. First up, acute vertebral fractures. Because of that lost bone density and the osteoporosis risks we just talked about, fractures can happen swiftly, sometimes without any immediate obvious cause. Next, we have herniated discs, which affect about 1 to 3% of adults. This occurs when the soft interior of a spinal disc literally pushes out through a tear. And finally, there's lumbar spinal stenosis, which is incredibly common in folks over 60. This is basically a gradual narrowing of the spaces within the spine, and that ends up putting immense pressure directly on your nerves. But how do you actually know what you're dealing with? Honestly, the way you describe your pain matters immensely. Is it a sharp, stabbing sensation? Well, that often indicates a nerve issue, kind of like a herniated disc. Or is it more of a deep, aching pain? That's highly suggestive of a muscular strain. Now, pay close attention here. If you're experiencing accompanying symptoms alongside the pain, things like numbness in your legs, sudden weakness, or even changes in bladder control, those are major red flags. They signal severe nerve compression, and that requires immediate medical attention. No waiting around. Which brings us to Section 4, Diagnosing the Root Cause, the medical detective work. Think of this next phase not as some scary medical ordeal, but as an empowering puzzle to solve. Let's move to and see how this builds a complete diagnostic picture. Step 1 is the physical examination. where doctors check your lumbar alignment, your overall range of motion, and just observe how you naturally sit and walk. Step 2 goes deeper with imaging tests, your X-rays, MRIs, and CT scans, hunting for things like fractures or arthritis. Finally, Step 3 utilizes advanced laboratory tests. Here they check inflammation markers like ESR and CRP, just to ensure there isn't some hidden infection secretly causing all your distress. If you're sitting there wondering how accurate this all is, be reassured. As reported in the Journal of Neurotrauma, advanced imaging like MRIs significantly correlates with the exact symptoms patients feel. It's not guesswork. This means these scans are a highly precise tool, allowing your medical team to craft a truly targeted, individualized treatment plan for your specific pain. Section 5. The treatment ladder, climbing toward relief. This is where doctors use a sequential strategy, carefully climbing from conservative care right up to more targeted interventions. So the crucial, burning question is this: how do we actually treat sudden, severe back pain when it brings your life to a grinding halt? Let's clear our minds for a second, take a breath, and look at the concrete solutions available today. You always start at the initial rungs of the ladder. First-line defenses usually involve medications like NSAIDs to quickly knock down that inflammation and pain. Next up is tailored physical therapy, which is hyper-focused on addressing the muscle weakness and mobility limitations that are specific to you. But if oral medications and physical therapy just aren't cutting it, doctors might consider injection therapies. In fact, research published in the Spine Journal found that epidural steroid injections can offer really fantastic temporary relief for acute radicular pain. They do this by delivering steroids directly to those inflamed spinal nerves. Section 6. The Reactivate Solution, Revolutionary Neurostimulation. This is where we look at an innovative medical device solution for those who simply haven't found relief anywhere else. What happens if you've climbed that entire treatment ladder and you are still hurting? For folks who haven't found relief through traditional means, there's an innovative approach that tackles the problem from a totally different angle. Reactivate is a first-of-its-kind restorative neurostimulation therapy, specifically designed for mechanical chronic low back pain. And restorative is absolutely the key word here. This therapy is targeted specifically at adults who have exhausted options like physical therapy and medications, but who aren't candidates for major spine surgery. It's really for patients whose critical lower back muscles simply aren't firing and functioning the way they should. And this brilliantly illustrates how it actually works. Rather than just masking the pain, Reactivate targets multifidus muscle dysfunction. Basically, that's a failure of the deep core muscles that are supposed to stabilize your spine. The implanted device stimulates the L2 medial branch nerves. By directly stimulating the exact nerves responsible for supporting your lumbar spine, it actually restores muscle control. This ultimately breaks that relentless, absolutely exhausting cycle of pain, weakness, and degeneration, finally returning true functionality to your core. So, I'll leave you with this final thought to ponder. Are you ready to address the root cause, break the cycle of pain, and reclaim the joys of your life? Tackling sudden, severe back pain requires a solid understanding of how your body ages, a very precise diagnosis, and a customized treatment plan. Whether that ends up being physical therapy or an incredible, innovative neurostimulation therapy like Reactivate, there is a clear path forward for you. Thanks so much for joining me on today's Explainer, and as always, stay curious.